There are two forms of treatment that I would highly recommend you stay away from if you have sciatica. Hi, I am Michelle Dominique, certified wellness coach, and I've been a lymphatic drainage and massage therapist for over 2 decades. There seems to be a new, not so new, but in the last several years trend of treating sciatica that I highly discourage clients from even considering. One is the epidural. Yes, that's right, epidural. You've heard that before. If it sounds familiar, it's because it's what's used during pregnancy to stop the pain. I gave birth and it took 11 and a half hours before I would consent to an epidural after reading the page that talks about paralysis. So I definitely was very leery to take that on. I figured the birthing pain would stop soon enough, but that pain, the possibility of paralysis and all that came with it. And by the way, I have worked on women who had children. Their children were in their 30s and they were still experiencing sensations, discomfort, zinging and snapping at the point of their epidural incision. So don't take that lightly, especially you got to if you're getting it during birth, that maybe once every 18 months at the most, and now it's being prescribed monthly. That is a huge needle. That is a major nerve canal. There is so much that could go wrong there. Please consider, don't do that. There are other ways to go about that. This video is based on, once again, an amazing client testimonial. I was so proud when I heard my client, who is a member of my family, relate to me a conversation that he had with a fellow colleague. He is a driver and he was coming in, and another driver should have been going out. But the driver was coming back to the office area and he noticed that he was limping. And he said, "Hey, what's going on?" And the driver's like, "I can't do it. I can't do it. I cannot go out. This sciatica is acting up and I can't even sit down, much less drive." So imagine that. Imagine what that's like when you are set to work for the day, bring in your income for the day, do your thing, and all of a sudden you're being sidelined. And not just that, but with sciatica, I have worked on people whose sciatica has been so bad that there was only one position that they could be slightly comfortable in. They could not sit. Standing was difficult. Walking was difficult. And also lying was difficult. So they were only lying on one side, which was right there causing another problem because you can only lie like that for so long. I mean, they were during the day lying in that position, at night trying to sleep lying in that position. So I know how severe sciatica could be. Don't get me wrong. I work with patients with sciatica all the time, but getting an epidural to continually deaden the nerve, there are so many more problems that you're going to face along the line. So I don't recommend doing that. And here's the thing. When they do the epidural, it's to deaden the sciatic nerve. What if I told you the sciatic nerve wasn't the problem? Yeah, that's not the problem. There's nothing wrong with the nerve. The fact that the nerve has started radiating that painfully meant that you ignored all the other signs. You don't just wake up. Like I tell my clients, you don't just wake up with sciatic pain. That's why I say in the beginning of my broadcast, I didn't say it here, but I normally do, helping you to reconnect to the signs and signals that your body sends you every day so that you can course correct and make changes before it gets to be code red. That's why I say that. And sciatica is exactly one of those things that you could stop it in its tracks. So let's go back to what sciatica is. This is your sciatic nerve. It's just hanging out, minding its business, doing its thing, right? The problem is your sciatic nerve sits in your glute. One in each glute. If you know anything about your glutes, there are three major muscles: glute major, medius, and minor. Plus you have the piriformis. That one is tricky. A lot of times it starts off and people come to me and think they have sciatica, and they don't. They actually have a clenched, over-tightened piriformis. So when those are at least four major muscles that I talked about that are in that area. There's nothing wrong with your nerve. It is the fact that and he was a driver, if you are constantly sitting. For men, if you are still sitting on a wallet, that is just diabolically disastrous. Get that wallet out of your pocket. But the whole crux of sciatica, yes, it is the nerve, but the nerve is crying out because those muscles have tightened, sitting down, same position, not stretching, not enough movement. Remember, glutes they're there to sit, to help you sit, but that was not supposed to be the primary position. So instead of trying to deaden the nerve, how about because the nerve is telling you something. Just because you deaden the nerve doesn't mean the problem goes away. You need to make some changes, especially in the area of stretching out your glutes and being mindful of the tightness of that muscle. Here's the other thing that so don't do that. Don't keep going in and getting those shots that can seriously leave you paralyzed. That's not a joke. That's not that is very, very serious. I've seen women with horrible post-delivery decades later from an epidural. If you're pregnant and you need it, it is what it is. But just to kill sciatic or to cut off a signal from your sciatic nerve, no. Follow the signal. And if your doctor has never told you, hey, why don't you find a massage therapy, not a massage therapist, not get a massage. There's a difference. There's massage as therapy and there's massage as relaxation. Okay. So the second thing is having the nerve cut out. Oh my gosh. What exactly is that supposed to accomplish? If you cut the nerve out, will the pain go away? Not like you think it will. Remember, I've been doing this for 20 years. I get a lot of but surgery was supposed to make it better clients, and it didn't. And yes, I have had a client or two who had nerves removed, and it did not make it better. Why? Because the problem was not the nerve. And so when you take out one nerve, guess what else happens? You've only taken out one nerve. There are other nerves there, and they will start to pick up where the major nerve left off. So please, your nerves are there to serve a purpose. Don't deaden them or shut them down. Take the time to figure it out, okay? So yeah, back to cutting the nerve out. I have never, and I've had clients have nerves cut in their neck and I have never seen one successful, did what it said it was going to do, alleviated all the pain. I'm just going to tell you, I don't know what your doctor is going to tell you. I don't know what when they say their success rate, don't just ask how they do the surgery, because I will tell you all the time, routine surgeries are only routine to the doctor that's performing them. It does not speak to how your body will adapt to the aftermath. And I do mean aftermath. I have not had one client who ever had a nerve removal have it be completely successful. I'm zero. Remember, 2 decades plus in this business, zero. If you are having sciatic problems, especially if it is affecting your job, I know you want to get back to work, but remember that job is going to end, and how are you going to live your life after? Think about that. I know you got work to do, but how are you going to live your life after that job? Because it's going to be a little difficult when you start deadening things and cutting things out. And I know I work with a lot of people who've retired, and they're desperately fighting to maintain the health that they have. Okay, so let's not do that. If you have a question, like, Michelle, I have sciatica, what are some things I can do? Because if you're not in my area and you can't come and see me, don't worry, I got you covered. There are some things, some steps that you can take that are simple. They just require consistency, but it can help you. You get so many signs. Like I say, before before your sciatica gets to the point where you can't work or do your job, or you can only lie in one position, there are so many other signs and signals your body sends you. It starts to really get bad right about the piriformis. Go ahead and pull up a chart. I'm looking at my chart right here. Probably should have sat over there. Let me see if I can click that. But yeah, you look perfect. If you can see where the glutes are on the right, there are a ton of muscles there. If that muscle group, look to the right, if that muscle group is compressed, and as you like to say, knotted up. Oh, I have a knot back there. Yes, just simply releasing that knot could release the nerves. The first time I heard that was being done, given an epidural, a gentleman, his girlfriend had sent him into the place that I was working. And he said, I never met him or her. Yeah, I have sciatica really bad. Oh, it's bothering me so much. She gave me this gift certificate. I don't know why, because I don't need to relax. This pain, I can't relax with this. I said, get on the table. Let's just try it. When he got off the table, he was shocked. The pain was gone. He came in limping. The pain was gone. And I explained to him the same thing I explained to you, that your nerve is not the problem. Your nerve is the alarm signaling to you, do something, do something, do something. It's not your problem. So stop trying to adjust the nerve and listen to what it's telling you. It's the muscles around it. Your doctors are great and they know a lot of things, but what they don't do is touch your body. They don't know muscles, not like they know muscles in a muscle chart way. They don't know muscles in a close-up, personal, let me see what's going on here way. I'll tell you before, I said it before and I said it again, it doesn't only take a village to raise a child, it takes a village to keep you healthy. So in addition, when you have somebody that isn't as well versed with something, you go to someone else who is. Like if you came to me and I worked on you and it was really a nerve issue, I'd send you to my friend, Dr. Andrea, the chiropractor. She works with nerves, right? Everybody has to have a piece. If all you have is a general practitioner, you need to expand your wellness circle. All right, so remember that 2 things we're not doing for sciatica. Number one, you are not getting an epidural. And number 2, you are not cutting nerves out of your body. Why do I even have to say that? But that's okay. You know now. Schedule your free wellness consultation with me. If this has opened your eyes and you didn't realize that there was a non-surgical solution to sciatica, you need to be calling me. Absolutely free wellness consultation. Hit my DM or whatever this platform is that you're seeing. I look forward to helping you live your best, healthiest life.